Welcome, and thank you for joining me for my next episode of Coffee with Andy. Today, we want to pick up where we left off, talking about expenses. And now that the enrollment period is over and everybody was able to learn about what Medicare covers and what it doesn't cover, and why you need something in place to cover what A, B, and D doesn't cover, we want to look more specifically at some of the expenses down the road that you may incur. And it all depends on what you choose, granted. However, there's also other unforeseen obstacles that we need to look at and talk about a little bit so that you're better prepared. So, I hope you like the library background because if you've noticed some of my um, backgrounds, they've all been themed to a certain point. The beach, for the sake of retirement. Some would prefer the mountains. I just happen to like the beach. So, to each his own, as they always say. The other ones, again, poolside, because we think of retirement in a sense of relaxation and enjoying life. Now we want to break that down after going through Medicare, as I said, and look at some of the other expenses that you may not expect. Now, keep in mind when I say you may not expect, when you and I were starting out preparing for retirement years ago, we figured we needed X amount. We might have calculated inflation. We might have tried to figure out how much it was going to be like. But on the other hand, we really didn't know, so it was our best crapshoot, so to speak. Now, as things have taken the course of direction that they have, some of those numbers may be off. For example, as we've said before, people are living longer. Okay, my mom lived an average age, lived till she was 74. My dad unexpectedly came down with colon cancer, passed at 65, between 65 and 66. Well, any long term planning that he would have done would immediately have been out the door, in a sense, although the medical expenses was something else. There's others who feel at 65, oh, I'm healthy as a horse. Okay, anyway. But you soon find that being healthy may work for today, but people are living, as I said, 10, 20, 30, 40 years longer. So what will you be like 10 years from now when you're 75, 80, 85? That's 20 years, and perhaps longer. You hear every day of people living to 100. So what if it was you? Where would you be? Would your family be taking care of you? Some of the thoughts I've had to go by, discuss, whatever you want to call it. Now, as I have worked with people in the Medicare field, especially with seniors, those who are recipients of Medicare is what I mean by Medicare fields, and even those that are handicapped that qualify for Medicare. Now, one of the common plans that I hear for the future is, oh, my family's going to take care of me. Okay, well, we didn't see COVID coming. We are still feeling the effects, whether they're dramatized or realistic. There is certain issues of health that has to be covered for one and reviewed, looked at. Then there's the family issue. Okay, the family now, according to some states' governors, can't come over. You can only have so many people in your facility. Now, will that be forever? Probably not. But what if something else comes along the way? If they're going to go this drastic for this particular virus, what could be done for other stuff? What could be done under other circumstances? And I'm not trying to be a paranoid schizophrenic. I'm just trying to be real. I'm not trying to be a conspiracist. Just trying to be real. Because you never know what can be happening. As you've seen in the last 20 years, there's been some major changes in our country's modus operandi, shall we say, for lack of better terms. So you plan for the family to take care of you. Great. Is everybody on board with this plan? Does everybody live on the same acreage like they used to do back in the good old days of Heaven Can Wait or whatever that show was with Michael Landon? Or, do people live, or do your family live close by, across town, down the street, around the block? Okay. Now, provided that they can get over there, that there's nothing hampering them, do you realize what you're asking them to do? Do they realize what they're being asked to do? Are they good with it? What do I mean by that? Well, let's just say you raised them and you changed their diapers. Well, now, as an adult, senior adult, you may have incontinence. Are you going to feel comfortable with your child taking care of you there? Of course, you may not feel comfortable with a nurse doing the same thing. But I'm just throwing it out there as an example. What about your child? Okay. Maybe they're a mechanic, never had to deal with the sight of whatever, meaning whatever. It could be blood, it could be excrement, things like that. Some people can't handle. Are you comfortable with that? Are they comfortable with that? Did they buy into that picture, or do they know what they were buying when they committed to taking care of you? Maybe, maybe not. But these things happen. My mother, as she got older, we feel had some kind of a cognitive issue, maybe a stroke, a very mini stroke or something. But one day we noticed that something wasn't right. And while mom was a good person and a loving mother, there was times where she couldn't hold a conversation because she really didn't know what was going on uh, in the background, going around uh, in politics, in the city, in the county. So, and then my sister took her in the sense that they were all in the same area. I was out managing hotels in a different state, so uh, when the conversation initialized, yeah, I had a facility a couple hundred miles away from where she lived, but uh, do I uproot her and take her to my facility, where, mind you, she doesn't have any friends, knows very few people, and being a child of the 20s, didn't have a driver's license. Kind of knew how to drive, that's another story. But realistically, uh, she would have been stuck at home. Would she have been comfortable with that? Wouldn't she have rather liked to stay with the family? In this case, my sister and her grandchildren, my sister's children, that is, for my mother's grandchildren, in other words. Uh, or did she mind, coming out to be with me as the older child? Well, I kind of left that up to her. And it was just easier for her to stay in town where I grew up, my sister grew up, where she knew people from the church, and there was a less of a transitional uh, change at that point. So, why do I say that? Yeah, not just to fill time, but to really get you to think about some of this stuff. Because you you might have a great plan in place, but has everything been examined? Today, a lot of times we hear, this is what you need to do. Well, I'm not telling you what you need to do. We don't like to think about these things, but they need to be considered. So, while you take on mom and dad, or they agree to have you help them, are you going to be comfortable with it? Are you going to be comfortable um, in the excrement? Just bottom line it. It's not just taking somebody back and forth to the doctor, walking them around the neighborhood, feeding them. It may involve a lot more. And I just wanted to take a realistic look. Again, these episodes are not designed to be selling you something. They're designed to be an educational event and to get you to think about some things. A lot of things, probably, in the long run, that most people aren't willing to sit down and talk about. If you have an open family, that's great, but not everybody does, and not everybody thinks about the whole picture. So, moving on, because I'm getting to the point of just jabbering, let's switch screens. I want to take you right now to my favorite website where I can talk about some of the expenses that are accrued after you turn 65. Okay, and what needs to be done. Keeping in mind, again, as I said, people are living 10, 20, 30, and 40 years longer. So I'm not talking about today at 65 if you're turning 65. I'm talking about 20 years from now, 30 years from now, 40, possibly. But you never know. And so, what kind of expenses can you expect at that point? We talked about Medicare. We know that Medicare only covers a certain limited amount of skilled nursing that is medically necessary. Medicare pays for the first 20 days of home health services, but what is that? Very minimal stuff, bottom line. Okay? Um, if you're not admitted to the hospital and stay for 3 days, you wouldn't qualify for skilled nursing, again, unless it's medically necessary, and that's up to the doctor to write. And what if you need care beyond day 100 or beyond day 20 for that matter? You have the money to come up with that 175.50 to cover the cost of nursing. What about day 150 if you've used up your lifetime reserves? Or even day 91 if you did have to use your lifetime reserves up earlier or in increments? Who pays? Well, it could be, in most of a likelihood, would be you, especially as we see a transition or a desire to transition to socialized medicine. That's been the argument as far as the F supplement and the G, or uh, the issue with the deductibles. We see that with F, if you were able to qualify for an F before January of 2020, you could still get an F. Well, that pays for everything out of pocket. G, though, you pay a premium, but you also have to meet the deductible. Again, as you may recall from the episode on Medicare coverage, that is increasing to $203. That is not $2.03, up from $198. Well, what's it going to be next year? 2022, 2023, and so forth and so forth. The speculation in the industry was that it would probably start to fall in line more towards the affordable care type product, meaning that your deductible could easily go to 500, 1,000, 1,500. What are you going to do then? So that's why we have these discussions, so you can think about and plan for what's going to work for you. I'm not saying this is a cookie cutting series. This is just to enlighten you so that we can, or that you can be informed and be secure. So, that being said, let's switch over to what I call my favorite website in some respects. And I use the Raleigh area because that's where I'm out of. And what this does, basically, let me go back down, it gives you some speculation as to what the cost of care for the long term, as I like to call it, is going to be. Most people confuse long term care with nursing home. Well, after you turn 65, care can mean any number of things, and this is just a high level review in case you have to uh, use any of these types of programs. That's why I call it care for the long term, because it incorporates all these different areas. First things to notice, okay, if we um, talk about you at 65 or us at 65, as I'm getting close to that window, we look at the cost of a monthly cost, mind you, of a private room. Will you want to be with somebody you don't know if you have to stay in a senior uh, nursing home facility? There's other types, and you see a lot of retirement communities developing. But in this situation, this is more of acute care where you really need more one-on-one care. And a private room, as you see right now, is $8,060. Now, most people, when I start talking about what you're going to need, I'm not talking 65. Heaven forbid. My biggest argument that I hear is, oh, I'm fine. I don't need anything. Oh, who's talking about today? Think about tomorrow, because today you might be fine and you may be able to work. I've got a customer right now that's 74, I think she said. She's still working, partly because if she continues to work, I'm sure she gets more. Oh, I know she gets more Social Security, but she also has to meet bills. And what happens when that extra income dries up? She's no longer able to get around. I mean. So these are things to look at. And again, she's 10 years out from retirement when all this is happening. Her mother, she introduced me to a couple years back, is, oh, good grief, I think mom is about 90 something. Well, mom wasn't informed that she needed a D plan and didn't sign up because she was too healthy, only took supplements. Well, now she's got to take medications and she's living in a facility. And these medications are costing her, at least a premium is for the drug plan, because she didn't sign up. Somebody didn't tell her or educate her well enough to know that she's going to have to pay more. Now she's in a facility, $8,000 a month on an average around the Raleigh, North Carolina area. And I could look at the national average. You can go to this site and pull it up if you need more information. Again, I'll be glad to help you. More commonly, though, you'll find that you need some type of home services. Now, Medicare covers home services, yes, for the first 20 days, but what is home health care? Basically, somebody comes out, make sure that you're taking your medications and you're eating, and chit chats, keeps you company for an hour or so, and they're gone. Okay, they haven't done a lot for you. But a couple examples of home health care, and in-home, I should say, in-home care and a home health aide. An in-home care provider are services that make it possible for people to live in their own homes or return to their homes by helping them complete household tasks like that they can't manage alone. Homemaker services aides may clean houses, cook meals, or run errands. Okay, somebody's got to pay them, and guess what? It's not Medicare, and it's not your supplement because it's not qualified under medically necessary. But these are some services that you may need to have. Another one is the home health aide. A home health aide helps those who live in their own homes instead of residential area or care facilities. Home health aides may offer care to people who need more extensive rather, personal care than family or friends are able to or have the time or resources to provide. A good friend of mine passed away a couple of years back now, but his wife was a mayor of one of the cities here in town. And about the time, I guess she retired, I think it was around 70, all of a sudden she had Alzheimer's. Other people have dementia, and those are two top uh, cripplers, shall I say, for seniors. You know, the lights are on, but nobody's home is the expression. And that's a perfect example, not to belittle anything. I'm not trying to be disrespectful. But, this man, he himself, 70 plus at the time, would be there for her day in, day out, overnight. Of course, they lived together, husband and wife. I did mention that, right? Anyway, sometimes she would get up, she'd forget where she was at, or she would get up not knowing what time of the day it was and try to start her daily routine. So at one point, they ended up hiring a person to come out and take care of her so that he could at least get out. Some may call it respite care, and that's a provision of Medicare to an extent, but a limited extent at that. He had to pay for this stuff because the services weren't something that was provided. So, you just never know, and this is the whole point of our conversation today. Another option is the community and assisted living type facilities. You know them as either an assisted living facility or adult daycare, basically. Well, an adult daycare can offer a break for caregivers. Okay, this type of care provides services as at a community-based center for adults who need assistance or supervision during the day, but who do not need around-the-clock care as opposed to an assisted living facility that is living arrangements providing personal care and health services for people who may need assistance with activities of daily living. The level of care provided is not as extensive as that which may be provided in a nursing home. Assisted living is not an alternative to a nursing home, but an intermediate level of long-term care. Again, that nasty word. Uh, and like I said, care for the long term. These are levels of care that you may encounter. Sure, mom and dad may be able to take care of themselves to an extent, but sometimes if the kids aren't close, something's happened, they can't get over there, what do you do? Do you have a backup plan? That's the biggest point that I want to make. Backup plan. Let me say that again. Backup plan. Did you get that? Backup plan. It's great to have the family and the family to care for you. But if things go awry, these are things that you would want to look at. And as I said at the beginning, uh, this is for educational purposes primarily, not to try to sell you a particular product. Because actually, to be honest with you, these types of care have different products that are available. You don't necessarily have to have a long-term care policy to meet these needs, but you can have different coverage so that you don't have to come out of pocket for homemaker services or assisted living. things like that. But incidentally, I forgot to point out before we wrap this up, as you can see here, even an adult daycare facility is over $1,400 a month and projected to go up to $2,642 in 20 years. I mentioned the private room. That's almost doubling in 20 years. And assisted living is doubling for all practical purposes. And then your homemaker services, health aid, close to all of that doubling within the next 20 years. And let's just take it out one more 10-year period. We can see obviously the effect of inflation and long term. Everything's more than doubled, more than twice. So, while today it's expensive enough, tomorrow can be even more expensive. Are you ready? Do you have what did I say? Backup plan. Exactly. You got it. I think it's beginning to sink in. So it's been a pleasure. I enjoyed talking with you today. Wanted to put some of this out there for you to consider. And let me switch you back over to my library. Again, as I said, for educational purposes, that's why I chose the library scene, because we're looking more at just the pleasurable side of retirement. We want to actually look at the cost. Join us next time where we will talk about a different aspect of care and things that you will need to know. Have a good day, stay well, and take care.